going ahead, I will pray and offer my respectful gratitude to Khemka sir, Agrawal sir, and whole ASPUS team. Okay, last time we have completed the brachial plexus, thoracic nerves, its testing and all that. So now we'll go ahead. I think all of you have this book, no? Manav Sharir Vigyan. So yeah, perfect. So I think there is no need to share the screen, especially. Okay. So you just keep watch on your book properly. We'll be doing this lumbar plexus now. First of all, I want to declare one thing. This all plexuses, you just have to remember their names. These are the plexuses present in our body. Just remember their names. Don't go detailing that much, which are the branches, what are the names of those branches. Those, each and every branch supplies to which part of the body. The body means which part of which muscles, which bones, which skeleton, musculoskeletal organ, like that. You just have to keep remembering these things. Under lumbar plexus, which are the organs come. And suppose those organs are having some problems, then we have to treat the lumbar plexus according to their branches and all that. But before branches, lumbar plexus is important. So now lumbar plexus is which are the branches? See, which are the segments of the spinal cord are related to the lumbar plexus. T12, L1, 2, 3, 4. These are the...
Sir, which book is you are referring?
Yeah, this one only.
Manav Sharir.
Yeah, Manav Sharir Vigyan. Red color. You all are in a third semester, no?
Yes.
So you must be having this book, I think, from first to, I think, third semester at least, this book should be there. Because in third semester, this book is completed almost. So if you are having difficulty, I can share the screen, no problem. I am having the book in soft copy also. Let me know.
Which chapter of this book?
This is page number 144.
144.
It's, I think, 11 number chapter.
Lumbar plexus.
Yes, correct. Lumbar plexus. So these are the branches now. Iliohypogastric nerve. So which is from L1 to T12. T12 and L1. Both comes outside the vertebra, means spinal cord, through vertebra. And it becomes a iliohypogastric, which supplies the quadratus lumborum muscle. These are the names of the muscles. Quadratus lumborum, transverse abdominis muscle, psoas major, psoas minor, and gluteal region. Gluteal regions. So backside. Okay. Lumbar region. Below lumbar, there is a back. That is L1, L2, L3. And this is L1, 2, 3, 4. Now ilioinguinal, L1, genitofemoral, that is L1 and L2. These are the muscles now. Ilioinguinal supplies to the skin of the groin, scrotum and labia. In the female, labia, and in the male, groin and scrotum. The skin over the scrotum and groin. That supplies by ilioinguinal. If somebody is having the problem with that, itching of the labia, itching of the scrotum, these are the common complaints. So we have to treat accordingly. L1. So one therapy is there. I think, I don't know, you might be knowing about PNST, peripheral nerve stimulation therapy. That is also the same thing. So if the problem is to the skin of the groin, scrotum and labia, we have to treat L1, means go to the back side of the vertebral column, find out the L1, and just L1, just there only, local stimulation should be there. So that problem will get solved. it is called as the peripheral nerve stimulation therapy, PNST. It's very fantastic. Otherwise, what to do? If skin is there, means yang is hyper. So what you will do on the L1, means this side. L1 is here, na? Half of the from half of this part, according to Sujo, half of the part, this L1, L2, L3, L4, L5, and then sacrum starts. So at the point of L1, we have to keep one ball magnet, which will be again sedation. It's a simple thing. The treatment part you should understand by knowing this lumbar plexus and all that. Again, the next one, genitofemoral or genital nerve, that is to cremaster dartos muscle labia majora. Okay, so this is the part of the female genital organs. Then again, femoral nerve, L2, L3, L4, cutaneous sartorius muscle, quadriceps femoris, pectineus muscle, saphenous nerve to medial side of the leg, ankle and foot. Then lateral cutaneous of thigh, obturator, L2, L3, L4 divides into two branches. Obturator nerve is divided into two branches. That is anterior or superficial and posterior or deep. Superficial and deep. So again, anterior obturator nerve is divided into hip joint, obturator externus, obturator longus, to gracilis, pectineus, and to adductor brevis. These are the names of the muscles. Again, you have to remember this. Don't remember in detail these muscles, but which area of the body it supplies, that you have to know. Posterior or deep to knee joint. Suppose knee joint problem is there, articular branch of the posterior deep nerve of obturator nerve. So that supplies to the knee joint. Knee joint pain is there. So it is from L2, L3, L4 again. One on Google, one wonderful picture is there. Okay, I will share that picture in group. So you will come to know which part of the body, suppose this part of the hand, this much part, which nerve is supplied to this much part. So any problem regarding this part, we have to treat that nerve. Okay. So that is very simple diagram. I will share that in group. Okay, and the seventh is accessory obturator, L3, L4. Its roots are coming from L3, L4. Accessory obturator, sometimes when is present, it innervates pectineus muscle. These are muscles. How the testing of this lumbar plexus happens? L1 testing, to test whether L1 segment of this nerve is properly working or not. We have to check the quadratus lumborum muscle, plexus vertebrae laterally, psoas plexus trunk. This is quadratus lumborum backside. L1, L2, L3, L4, local area and the parallelly both side, right and left area. L1, L2, cremaster reflex elevates testes. Now see, this is wonderful test. Cremaster reflex. It is called as a cremaster reflex. Elevates the testes. If you will just do some stimulus to the testes, it will go up. If it is going up, that means your cremator reflex is positive. That means L1 and L2 are working properly. If it is not happening in some patient, that means L1 and L2 are having some problem. This is the test. Okay, L2, L3, L4, sartorial plexus, thigh and leg together. If we will go to the thigh and give some stimulus like this, and if stimulus is less there, if paresthesia is there, patient is not feeling the touch or pressure, any stimulus, he is not responding to any stimulus, then it is problem of L2, L3, L4. This is the testing method, just testing method. Then L4, quadriceps femoris, abductor of hip. Okay, just forget everything at this level. You have to remember the area, which area of the body is supplied by lumbar plexus. That's it. Next is sacral plexus. There are 5 vertebrae again. Lumbar, after lumbar, there is a sacrum. 5, 1, 2, 3, 4, 5. Okay, but sacral plexus, L4 and L5 segments are also included in the sacral plexus because they are coming down. You can see in the diagram also. In picture, page number 145. If you will see carefully, S1, S2, S3, S4. sacral plexus. But some nerves are coming from the L4 and L5 also to connect with the S1. That's why this is called as sacral plexus. Means it is also include L4, L5. It has a two divisions now, anterior division and posterior division. Anterior or flexor, all the flexions of all the body organs, flexions of all the organs is happening because of this anterior division, and extensions of the leg or lower extremities is happen because of this posterior division of L4, sacral plexus. L4, which include L4, L5, S1, 2, 3, 4. And these are the nerves again, which are coming under the anterior division and the posterior division. Okay. To the obturator internus, to gemellus superior and inferior, to quadratus femoris, to hamstrings, backside. Now, hamstrings are backside muscles of the thigh and backside muscle of the calf. The muscles on the calf and backside of the thigh. These are the hamstrings, which are called as the hamstrings muscles. Posterior cutaneous nerve of the thigh, then recognized as a medial popliteal nerve. Again, posterior division to piriformis. It is a muscle again. Piriformis, then superior gluteal nerve, inferior gluteal nerve, then recognized as lateral popliteal nerve, anterior tibial, musculocutaneous. These are the branches again. Posterior tibial, medial plantar, lateral plantar, pudendal nerve. Pudendal nerve is especially from S2, S3, S4. It is supplies to the genital organs of both in male and female. Pudendal. Then cutaneous nerve, pelvis, planchnic nerve. Now it is again this peroneal sciatic nerve. Now we will see what is sciatica and sciatic nerve. The composition of sciatic nerve. There are the two branches, common peroneal nerve and tibial nerve. These are the two branches of the sciatic nerve. If you will go on Google, you can see one picture of sciatic nerve. Wait a minute. Wait a minute. I will share my screen. My screen is visible?
Yes, sir.
Okay. You can see this is sciatic nerve formation. They have mentioned here. My cursor is visible, no?
Yes, sir.
Yes, sir.
To see sciatic nerve, we will go into
research is going on. Like I'm seeing the first page only, like what we are doing.
sciatica. Okay, we will see the simple diagram. We can understand through this also. This one. Thank you. See, this is the sciatic nerve. Okay, these are the branches of the sciatic nerve again. Superior gluteal, then pudendal nerve, obturator internus, posterior femoris cutaneous, perineal branch, then descending cutaneous, tibial nerve. See, this is the tibial nerve. Tibial nerve, common peroneal nerve. These are the two branches. Again, you can see sciatic nerve is having two branches, common peroneal nerve and this tibial nerve. These are the two branches. See, this is common peroneal. This is tibial. It is just divided just above the knee joint. You can see. This is knee joint. These are the muscles. Okay. They have mentioned the names of the muscles again. See this. Pectineus muscle. All the names are mentioned. You can see in the Google. In the detail, you can see any picture. Now, the tibial nerve is having the branch is medial sural cutaneous nerve and tibial nerve. And these are further branches. Medial calcaneal branch is there, which is supplying to the toe, this heel part, and the back side of the leg. This peroneal anastomotic. Anastomotic means two branches come together. It's anastomosis. These are the branches. And this sciatic nerve comes from the L4, L5, S1, S2, and S3. Okay. So where there is a sciatic pain, we have to treat L4, L5, S1, S2, S3. So if sciatica patients are there, we have to treat here only. L4, L5 below part and S1, S2, S3, S4. So if we will have Biol magnet, simple Biol magnets, which is in a sedation, means yellow magnet on this region, 1, 2, 3, 4 magnets at least it will require. So sciatica pain will go. And there are in TCM, this is a direct method correspondence. And if in TCM, which are those points? 2 points. This GB30 and GB31. These 2 points are enough to treat sciatica pain. So you have to remember this course of the sciatic nerve. Now branches. Hamstring, muscles of the back of thigh, tibial branch, common peroneal, superficial peroneal, and deep peroneal. These are the 5 branches of the main branches of the sciatic nerve. Now, hamstrings, which are the nerve supply for the hamstring group of the muscles? Biceps femoris, semitendinosus, semimembranosus. Okay. Then they are extensors at hip joints, flexors at knee joint. Then calf muscles on the calf muscle. These are hamstrings of the back side of the thigh. Now calf muscle. Calves are soleus muscle, tibialis posterior, flexor digitorum longus, and flexor hallucis longus. These are the flexor of ankle, inverter of foot. To flexion, because of these muscles, this flexion of the ankle happens. This movement is happening. Okay. Okay, the testing of the sacral plexus. No muscle in the leg is innervated by a single spinal nerve. This is innervation is too much, means so many nerves are involved in a single muscle. So L4 quadratus femoris, abductor of hip, along with rectus femoris and 3 vastus. Which are the 3 vastus muscle? That is vastus lateral muscle, vastus minimus, and vastus medialis muscles. Then L5 flexor of knee, S1 calf muscle, S2 small muscles of foot, S3, S4 pelvic muscles, obturator internus, piriformis, levator, and coccygeus. And coccygeal plexus is now coccygeal plexus is S4, S5, and C1. Coccyx 1, because the spinal cord is up to L4 only, and from there the only tail part remains. So this is C1. Is including in that. Anococcygeal nerves to coccygeal muscles and to the skin in coccyx region. This much is the coccygeal plexus. 2 nerves from S4 and S5, the 2 branches, 2 segments are coming from the S4 and S5. They are included with the C1, and that forms the coccygeal plexus. Okay, so this, just remember the plexuses: brachial plexus, celiac plexus, lumbar plexus, sacral plexus, thoracic nerves, thoracic plexus, cervical plexus. 5 plexus according to your vertebral column. Means cervical plexus is there for cervical vertebrae. Then brachial plexus, which is from thoracic nerves. then lumbar flexus from lumbar and sacrum, and then sacral flexus, L4, L5, and S1, S2, S3, 4, S4, and coccygeal flexus. Okay, now we will go to the movements of joints. What is meant by movements of joints? All joints are moving because of two things. The means two bones combined together to form a joint, and above the joint there are various muscles which are called as the skeletal muscles. Because of those, these movements are happening. So now you can see every joint they have shown and which muscles are involved in the movement of that particular joint they have mentioned. Okay, we can see one by one. Shoulder joint, abductors and lateral rotators. These are the muscles. These are the common names for the muscles. Abductors and lateral rotators. Which are they? You can see on the page number 148. You can see shoulder joint. Abductor. Which are the abductors? Deltoid muscle and suprascapularis and infrascapularis and teres minor. These are the four muscles which are called as the abductor muscles of the shoulder joint. Which are the adductor muscles? Means adductors or medial rotators. Medial side rotation. This is the shoulder. This is the adduction. This is adduction. This is abduction. This is adduction. This is abduction. Abductions means lateral rotation. Laterally rotated, and shoulder when it comes towards the body, that is adduction. That is medial rotators. Which are the muscles involved while medial rotation? Medial rotation is pectoralis major, latissimus dorsi, and teres major and coracobrachialis. These are the names of the muscles. Okay, and the medial rotation, pectoralis major, deltoid, latissimus dorsi, and teres major. These are the muscle for medial rotation. So you just have to remember shoulder joints. Shoulder joint is laterally rotated, this medially rotated, and these two movements are called as the adduction and abduction. Okay, in the diagrams they have shown how to move the hands and like that. Shoulder. In the first diagram, internal and external they have shown. Now come to the next joint. Okay, lateral rotation is infraspinatus, deltoid, and teres minor. Extension, deltoid and teres minor. And flexion is because of pectoralis major, deltoid, coracobrachialis assisted by biceps. These are the biceps and these are the triceps. Here on this side. These are the biceps upper side. On supine position. These are the biceps. Okay, and these back side are the triceps. These are the muscles. You can if you are more interested, you can go on the Google and properly see each and every muscle where they are located in the body. But just now only you have to know the movements of the joints. Shoulder joint, how we can rotate it? Lateral movement, medial movement, flexure. Flexure means this is flexion, this is extension. You can hold your hand like this or like this. Anyhow, this is forehand. So you can keep it like this or like this. But the shoulder movement, it's abduction, this is adduction. Now elbow joint. This is elbow joint. How flexion is because of brachialis. Now see this biceps. Biceps, brachialis and brachioradialis. This is radius and ulna. Two bones are there. Radius and ulna. On the finger side, there is a radius. And on the little finger side, thumb side, there is a radius, and on the little finger side, there is ulna. Okay. So this is one muscle is brachioradialis. On the radial side, the muscles is inserted. So this is called as a brachioradialis from the chest. Brachioradialis. Brachial plexus is supplied to this muscle. So flexion of the elbow joint. This is a flexion. Flexion of the elbow joint is because of brachialis, biceps, brachioradialis. Extension of the this elbow joint happens because triceps. This triceps is important for you can put one hand here and just flex this and extend this. This below muscle is this backside. This muscle is moving. See, it's a stretch. You can feel the stretch of that muscle if you are extending your elbow joint. If you are extending your elbow joint, you are feeling here. Okay. These are the triceps and anconeus. Like that, for flexion, this muscle is being, for flexion, you can put your hand upside. For flexion, you can feel here. Okay. So flexion happens because elbow flexion happens because of this brachialis, biceps, and brachioradialis, and extension happens because of this triceps and anconeus muscles. Okay. Now radio-ulnar joint means radius and ulna. In between there is one joint, radio-ulnar joint. Pronation and supination. These are the two movements happened. Pronation and supination. Radio-ulnar joint. This is pronation. This is called as pronation. Means supine. This is supine and this is pronation. If I will see like this, this one, this is pronation, supination, and this is pronation. Pronation means backside. Means this is my backside. This is pronation. This is supination. Supine position means I have to sleep like this. Supine position. Front side. Means front side, and back side is a pronation. So this is supination, this is pronation. These movements are happening because of this radio-ulnar joint. Supination, pronation. Supination, pronation. It is from elbow to wrist. Supination and pronation. Actually, this is moving. This part is moving actually, but this is along with this. The forearm is also moving. Supination, pronation. So these movements, supination because of the pronator quadratus, supination because of the supinator, and pronation because of the pronator quadratus. These are the muscles. Now come to the wrist joint. Wrist joint. Wrist joint is flexion, extension, adduction, and abduction. Wrist joint flexion like this. Flexion. Extension. Flexion is like this. Flexion below. Okay. Flexor carpi radialis, flexor carpi ulnaris, palmaris longus, assisted by flexor digitorum superficialis, flexor pollicis longus, and abductor pollicis longus. These are the muscles involved in flexion movement of the wrist joint. Extension, extensor carpi radialis, extensor carpi longus, extensor carpi ulnaris, assisted by extensor digitorum and extensor indicis and extensor digitorum minimi and extensor pollicis longus. These are the muscles. Now adduction. This is adduction. Adduction towards my body, and abduction means up away from the body. Adduction, flexor carpi ulnaris assisted by extensor carpi ulnaris. Abduction, flexor carpi radialis assisted by external carpi radialis, extensor carpi radialis. Okay. Supination, pronation. Adduction, abduction. Just remember these four movements of the wrist joints. Now hip joint. Come to the hip joint. Flexion of the hip joint. Like this. I am sitting like this. So this is the flexion. Flexion of the hip joint. And extension of the hip joint. If we are in a standing position but still erect standing, that is extension of the hip joint. Or the back side. We are extending on the back side. If we are in a prone position, if we are sleeping, and if we are elevating our leg from the back side, from the thigh, from the hip joint, that is a extension. So in the flexion, psoas major, iliacus, assisted by pectineus, sartorius, and rectus femoris. In extension, gluteus maximus, assisted by hamstrings muscles. See, backside, on the thigh, backside, there are hamstring muscles. So for extension, these hamstrings muscles are helpful. Now add abduction and adduction. Again, to go away from the body, from the hip joint, if we will turn our leg like this, that is abduction. Towards body, that is adduction. So for abduction, these muscles, gluteus medius, gluteus minimus, assisted by tensor fasciae lati and sartorius. For adduction, abductor longus adductor brevis, adductor magnus assisted by pectinis and gracilis. Now lateral rotation. Lateral rotation. Now I have elevated my leg up to means fold leg from at the knee joint and then go away like this. So that is lateral rotation and medial rotation. Medially, I can do my leg like this also and like this also. These are the leg rotations. Lateral rotation, medial rotation. For lateral rotation, obturators, gemelli, and quadratus femoris assisted by piriformis, gluteus maximus, sartorius, and adductors. Medial rotation, tensor fasciae lati, anterior fibers of gluteus minimus. Now come to the knee joint. Knee joint is having flexion again. Okay. Flexion, extension, dorsiflexion, plantar flexion. That is the ankle joint. Knee joint is flexion and extension. We can just flex the knee joint properly, but extension is not proper. Extension is when we are standing erect. If normal standing is like a little curve is there in the knee joint also, but standing erect, when you know that Tadasan, at the time of Tadasan, we can do that erect posture of our standing. So that time, this is called as the extension of the knee joint. Flexion, biceps femoris, semitendinosus, semimembranosus, assisted by gracilis, sartorius, and popliteus. Popliteus muscle is the back side of the knee joint, popliteal fossa. Okay. Then extension, quadriceps femoris, assisted by tensor fasciae lati. Just know the movements. Just remember the movements of the knee joint. Only flexion happens properly. Extension is little bit. Now come to the ankle joint. Dorsiflexion and plantar flexion. Ankle joint means like this. In a wrist, in the case of a wrist joint, we have seen this is flexion and this is extension. Like that, when ankle folds upside, that is called as a dorsiflexion. Dorsal part of the above part of the ankle joint means foot is called as a dorsum. That's why this movement of the ankle joint upside, that is called as a dorsiflexion. And plantar flexion means this is plantar fascia, sole, the from the toe to the heel below. Sole part is there is a plantar muscles. So plantar fascia is there. So that's why this movement is called as a plantar flexion of the ankle joint, and this movement is a dorsiflexion. Okay, understood? Yeah. So in the dorsiflexion, tibialis anterior assisted by extensor digitorum longus and extensor hallucis longus and peroneus tertius. And plantar flexion, gastrocnemius soleus assisted by plantaris, tibialis posterior, flexor hallucis longus, flexor digitorum longus. Now these are some movements again. They have shown the forward bending, extension, lateral bending, rotation of the body, left and right rotation of the neck or head, then flexion and extension, lateral bending, everything. We know that lateral bending, right lateral bending of the neck, left lateral bending of the neck. Then this is flexion, this is extension. Extension back side, flexion is front side. This is right lateral bending, left lateral bending. Okay, this is a rotation. These moments and these moments are different. You know, this is a right lateral bending, left lateral bending. This is flexion, this is extension. And if I turn my head towards the right side, this is rotation, right rotation, left rotation. So rotating. This is bending, this is rotating. Okay. Now we will come to the very toughest part of this central nervous system, that is spinal cord. Okay. Spinal cord. To study spinal cord internally, we have a transverse section. We have to cut the spinal cord at the level of the C4 and C5. This is the C4, C5 part. C4, C5. Where you have to cut the spinal cord. Transverse section of the spinal cord. Take the transverse section and look it from the above or from below. Anything. Transverse section, so that we can understand what are the contents of the spinal cord actually. To see those contents, we have to cut the spinal cord at the level of C4, C5. This is just imaginary thing. So we have to imagine now, and the diagram is on the next page. We have cut take the transverse section now, C4, C5. We can see following structure. It is made up of the two parts, two equal parts. Now, one is a central canal, and the second is a gray matter, and third is a white matter. Two equal parts means from the center there is a symmetry on the both side. That is a two equal parts. So it is divided now on the both side, but which contains the three parts: the central canal, from which the cerebrospinal fluid is flowing. Cerebrospinal fluid, which is the main content of the brain, and through the spinal cord up to the last end of the spinal cord, there up to that end, the cerebrospinal fluid is continuously flowing, which has the main function of keeping or maintaining or regulating the body temperature. Okay, that is central canal. Then gray matter. Out of the central canal, there is a gray matter arranged in H shape. You can see in the next page diagram, 156 page number, there is one diagram. H shape is there. The middle part is like this, on the both side like this, and the middle part is connecting to both of them. It is H shape. If you want to see it very clear, yeah. You can see that is medulla oblongata, but it is similar in a looking. You can come to the page number 164. 164. Brainstem, they have shown the brainstem. Correct? It is H shape. This is H shape. So just to show the H shape, I mention the page number. Okay, this is H shape. H shape, which has nerve cells and blood vessels. There are countless neuroglial cells at mid of nerve cell in it, through which nerve cells get the elements of blood. Gray matter, which is a gray matter, that is central canal is there, which is very small. Then this is H shape, that is a gray matter, and white matter. The left part is white matter. It is full of bundles of axons. These are of two types: ascending or afferent tracts and descending or efferent tracts. Now again, remember this. White matter contains these two tracts, ascending or afferent. Ascending means what? The name of this word is itself suggests. Ascending means what? Means from body organs, it goes to the brain. That is ascending. With different body organs to the brain. It gives the sensation. Means that must be sensory. Perfect? That must be sensory. Any sense which gives the stimulation to the, which conveys its messages to the central nervous system, center brain. That is ascending pathways. That are the sensory or afferent. And descending means motor. According to the stimuli, according to the message which is sent by any organ or any system, that reflex is coming from the central nervous system. Reflex is coming from the brain. That is a deep descending pathways, descending tracts, which is called as the motor. Motor in origin. If some pin is pinched or somebody has pinched here, so that gives the stimulation, and from afferent tracts it goes to my brain, and then brain, this is sensory. Then brain, what does brain? I will just remove my hand from the pinch like this. So this is the stimulus. This is because of the motor thing, which is because this movement requires the motor impulse from the brain. So this is the descending tracts or afferent tracts are crudely motor in origin, motor pathways. Okay, now you can just go ahead. We will go ahead. Sensor or ascending tracts. Sensory or ascending means ascending tracts means what now? What it contains. These are the tracts which originates from the receptors present on skin, muscles, and joints, and travel to spinal cord through spinal nerves, and finally to brain by forming bundles. See, now spinal nerves are, this is the meshwork. This is a very complex network of the nerves. Spinal nerves is just spread all over the skin, all the organs, muscles, joints, everywhere. So anywhere the stimulus, we get the stimulus, that through the spinal nerves, which are connected to the spinal cord, it gives the sensation and will travels through the spinal cord, and ultimately brain recognizes what happened, and then the reflex comes back. So now what are the contents of this sensory or ascending tracts? Okay, actual tracts. Now in this diagram on page number 156, you can see the different tracts. They have just mentioned the initials. In the right side, FG, that is fasciculus gracilis. This is the nucleus. Now FC, that is fasciculus cuneatus. This is FC. These are just part. Look at that part. If you will, if you can Google it, you can find out a wonderful diagram also of these parts, different parts. Okay, I will see whether it is. Whether I can do or not. Wait a minute.
मिनट की रह गई।
अच्छा जी।
इंग्लिश क्लास इनको भी लगता होगा यार, कोई भी नहीं है इस समय तक ना, भाग जाते सारे, आपको जिनकी पढ़ाना है क्या, ये थोड़ा देखिए। सुबह क्लास आपने करी?
Yeah, you can see that this there are the diagrams, different diagrams.
अच्छा वही है ये।
I think this is best one. Yeah, this one is best. Wait a minute.
निकाल के रख दिया।
Is this visible?
Yes, sir.
Okay, actually they are not allowing to see this diagram also. Yeah. Yeah, now it is clear.
Yes, sir.
Yeah. See this posterior funiculus. You can see it. Posterior funiculus. Funiculus cuneatus. This part, this much part is a fasciculus cuneatus, and this much part is a fasciculus gracilis. Okay.
Okay, sir.
Now fasciculus gracilis. It is made up of the nerve fibers of coccygeal spinal nerves. Coccyx. We have seen the coccygeal plexus. Okay. L4, L5. S4, S5. And C1, this is coccygeal nerve plexus. So this is coccygeal, from coccygeal spinal nerve, their fibers have come here. Fasciculus gracilis part, okay, this much, fasciculus gracilis. Then these fibers ends in the nucleus gracilis situated in medulla. That is a part of the brain, medulla. Now, fasciculus cuneatus, this part, this much part, fasciculus cuneatus. This part, it is made up of the thoracic, T6 and T1, and cervical spinal nerves. It ends in the nucleus cuneatus situated in medulla. These fibers are found under T7 of spinal cord. Both of these tracts carry the sensation of fine touch sensation carried by this fasciculus cuneatus. Okay. Then vibrational and visceral, discriminative touch, whether this touch is best or good touch and bad touch, we know that. So this discriminative touch, and then proprioception information of the brain. Okay. Now spinothalamic tract, you can see here spinothalamic tract. We have they have mentioned on page number 156 spinothalamic tract. That is on the right side, STH, that is spinothalamic tract. The different parts, but it is not visible here.
So we have to learn these.
Yeah, see this. This is anterior spinothalamic tract. This one. My cursor is visible?
Yes, yes, sir.
Yes, this is anterior spinothalamic tract. Okay. And on the back side, there is a posterior spinothalamic tract. So this is anterior, like this posterior backside or lateral also, lateral spinothalamic tract. See, this is lateral. This is anterior on the front side. Means I have taken the cut section now of the spinal cord. So front side, this is anterior spinothalamic tract and this is lateral spinothalamic tract, lateral side. So what are the contents of the spinothalamic tract? See, the fibers of these tracts originate from the receptor of the skin and reach to spinal cord through spinal nerves. These form synapses with nerve fibers of spinal cord. So the nerve fiber of spinal cord travel through medulla, pons and midbrain and reach to thalamus. This tract carries sensation of pain. You just have to remember this thing. What is the function of the spinothalamic tract? This underline. This tract carry the sensation of pain, coarse touch and temperature from the skin to the thalamus. This is very important for you.
Sir, the same function can be lateral also?
Yes.
The,
Yes.
okay.
Spinothalamic tract is especially made for this function. The half part of spinal cord receives the impulse from the opposite half part of the body. You know, this spinothalamic tract means all these tracts, why they have what we have to study these tracts, because the sensations or all the things are crossed in this even motor plexuses are crossed. Means somebody is having the paralysis of left hand, left side of the body. There all the tracts, motor tracts are coming from the right brain, right side of the brain. So these are crossing at these junctions. These tracts are especially see this, the one line, last line in the spinothalamic tract. The half part of spinal cord receives the impulse from opposite half of part of the body. That means these are the crossing. These tracts, these nerve fibers, these nerve plexuses are crossing from the brain. From brain it has come down and crossed into the spinal cord. From the right goes to the left and from left goes to the right, like that. Now come to the next tract. You have to remember the names of the different tracts or the name of the different contents of the spinal cord and their functions only. And don't go in that much detail. And just remember this diagram of the spinal cord, the transverse section. Okay. Spinocerebellar tract, just like a spinothalamic tract, these fibers also originate from the receptors of the skin, but they also have fibers of bones, joints, tendons, and also muscles. These carry impulse of opposite half part of body as well as partially from the same side also. Opposite and same side. They carry impulse related to body posture, body balance. See, these are the functions: body posture, body balance, and movement of the bone to cerebellum. These are the functions of the spinocerebellar tract. Now, fifth tract is a spinotectal tract. Spinotectal. Tactile means touch. These fibers originate from the skin. And what? These fibers originates from the skin, muscles, and joints and travel to the midbrain through spinal cord. The main function of these fibers is related to spino-visual reflex. Spino-visual reflex. Okay. This is the main function. Huh? Spino-visual reflex comes from the spinotectal tract. Just one line you have to remember. Which tract of the spinal cord is related to spinal visual reflex? Spinotectal tract. Now motor or the descending tracts on the next page. Motor or the descending tracts. These are of two types, pyramidal tracts and extrapyramidal tracts. Now pyramidal tracts, or it is also called as the corticospiral tracts. The fibers of these tracts are the axons of pyramidal shaped nerve cells situated in the cerebral cortex, which go down to spinal cord through midbrain, pons, and medulla. Now, to understand these structures, come to the page number 159. Next page. You can see this diagram. There is a brain. See, these are the descent of pyramidal tracts. Okay, cerebral cortex means this brain proper, cerebellum. These are two hemispheres of the cerebellum here in the skull. Okay, now brain is divided into, from here, the back side of the brain. Now spinal cord has to go from the back. No? So this is the brain actual structure, cerebellum. Then the internal capsule is there in which connects to the cerebellum to the midbrain. Okay, then midbrain is the second part. Then next to midbrain there is a pons, which is the part of the brain. Then below pons there is a medulla. Okay, medulla is the part, and from medulla this spinal cord starts. Correct? Spinal cord is nothing but the part of the medulla, which is the part of the brain. This is called as brain stem. Brain stem. Brain stem means the root of the brain. Brain stem is again divided into three parts: midbrain, pons, and medulla. This is called as a brain stem. These three parts of the brain, and then from medulla, this spinal cord starts from medulla. Just to understand, imaginary, we will see that in the diagram perfectly, but this is just how to imagine this. Okay, this internal capsule, then midbrain, pons, and medulla. And from medulla, this spinal cord starts. Now we will see the pathways again. Come to the pyramidal or corticospiral tracts. The fibers of these tracts are the axons of pyramid-shaped nerve. See, the fibers are axons of the pyramid-shaped nerve cells situated in the cerebral cortex. What is the shape? Pyramid-shaped. That's why it is called as the pyramid. Okay, which go down to the spinal cord through midbrain, pons, and medulla. The 65 to 70% of the pyramidal fibers descend to opposite side, means crossed pyramidal fibers, and rest 30 to 35 descend same side of the spinal cord. From spinal cord, these fibers travel to different organs of body through spinal nerves, all the cranial nerves except third, fourth, and sixth. Which are the third, fourth, and sixth spinal nerves? Have you remembered the names of 12 spinal nerves? Which is the third one? Oculomotor. Fourth is trochlear nerve. Correct? And the sixth one is abducens nerve. These three nerves are attached to these fibers. All the cranial nerves except 3, 4, and 6. These three nerves are not attached to the pyramidal or corticospinal tracts. Okay. Now these fibers control all the activities of bone muscles and generate movement on related bone joints. Okay. Now extrapyramidal tract. Now see the difference. This group contains the 6 tracts which do not originate from the pyramidal shaped nerve cells of the cerebral cortex. These are not pyramidal shaped nerve cells. And in the pyramidal tracts, they are the pyramidal shaped nerve cells. Now in this, there are different tracts. 6 different tracts. We will see that one by one. 6 different tracts. One is the corticobulbar tract. Corticobulbar. Just wait for 2-3 minutes again. More. These tracts don't descend down to spinal cord. The nerve cells of this spread in the area of pyramidal tract and also in the area around it, and their axon end in pyramidal tract. This tract helps in the movements of the, just remember this word. This corticobulbar tract is helping for the movements on bone joints. Finish. One line answer. Movements on the bone joints. Okay, this is corticobulbar tract. Come to the page number 160. Next page, 160. This is second tract, rubrospinal tract. Okay, rubrospinal tract. Rubro means red. Rubro means red. This tract is formed by the axon of the 2 oval-shaped red nucleus present in the midbrain. This is situated very close to the pyramidal tract, partially overlapping. This tract helps. See now, one last line. What is the function? This helps carnivores to hunt their prey with cunningness. This is the cunningness of the animals. Carnivores means what? Non-vegetarian, which are eating the non-vegetarian food. So for in the carnivorous animals, this rubrospinal tract is helping to get their prey, उसका शिकार पकड़ने के लिए जो चालाकी लगती है, that is very important. This rubrospinal tract is very important to catch the prey. To catch the prey for the carnivorous animal. Okay, carnivorous people, carnivorous animal. Now, third is a vestibulospinal tract. There is a big vestibular nucleus at the junction of the pons and medulla, whose nerve cells, axons form this tract. This tract is helpful for visual spinal and audio spinal reflexes. Just remember this. Remember one point, single line. Visual spinal and audio spinal reflexes are because of vestibulospinal tract. One line. Then next, tectospinal tract. The nerve fibers of this tract are situated at tectum part of the midbrain, whose axons form this tract. This tract generates reflex according to the senses of eyes and ears. See, this tectospinal means what is the reflex according to the senses of eyes and ears of the neck? See, if I am having some stimulus from this side, see what is the action I am doing. If I am somebody is kicking me from this side blow is coming, and I have seen that. Okay, I have seen that somebody is just kicking me from this side. So senses of the eyes and ears, and I am listening the sound. Somebody is coming from this side. So I have to turn my neck on this side. On this side. Quick movement of the neck because of the audio and visual reflex. These are generated by this tectospinal tract. Generate the reflex according to the senses of eyes and ears on the neck. Any movement of the neck because of the quick movement of the neck is happened because of this tectospinal tract. Okay, which is seen and listened. Then fifth is a oliospinal tract. The nerve cells of this tract are situated in olivary nucleus of medulla, whose axons form this tract, and their function is still unknown. They have completely mentioned their function is still unknown, and they are related to thalamus. Now, sixth tract is reticulospinal tract. There is a network of spinal nerve cells into the entire length of brainstem, which work in a group. It is related to all afferent and efferent tracts, so it is known as the cerebral cortex. This tract regulates, see the function, one line function. This reticulospinal tract regulates the sleep and awakening function of a person and help to reduce the stress in a bone muscles. To reduce the stress in a bone muscle and help into the to regulate the sleep and awakening function of a person. Okay, these are the two functions. You just have
Sir, your voice has gone. Sir, आवाज नहीं आ रहा है आपका.
And sir, it's already here in 7:40.
Sir, we cannot hear you.
Class is over.
Vani, do you also having the same problem?
Yes.
Yeah, same problem is here.
Can you hear the sir?
No, not sir. I can hear you. Maybe
Okay.
sir has some issues. He has left. He will log in back.
आपका ना इसकी लाइट ऑन है मोबाइल की.
Yeah, sir is back.
Maybe class is over.
we will conclude today's lecture and we will meet tomorrow. Thank you very much.
Thank you.
Thank you, sir.
Thank you,
I
sir.
think
Thank you, sir.
internet problem I am having.
Okay, sir. No problem. Thank you, sir.
Okay. Thank you very
Namaste.
much.
Namaste, sir.
Namaste, sir.
Hare Krishna, sir.
Hare
धन्यवाद
Krishna.
सर.
Namaste, sir.
Thank you.